Hi everyone. Today we will be seeing about the organ function tests. And in the organ function test, we will cover two major organs, which are the renal function tests and the liver function tests in short. So what are the renal function tests? You know what is the function of kidney, right? Excretion. And also it has various other functions such as acid-base regulation, electrolyte balance, and also it leads to the activation of vitamin D. So there are various functions of kidneys. So how are we going to test the various functions of the kidneys? So we have the different groups of tests, which are glomerular function test, you have the tubular function test, and you have the urine analysis. So what is the function of glomerulus? Glomerulus function is to filter. So the glomerular filtration is a major function of the glomerulus. Then you have the tubular function test. You know what is the function of tubules, right? The tubules help in concentration. So concentration is a concentrating ability of the kidneys is mainly because of the tubules. And then the most important test which gives rise to many clues towards diagnosis is the urine analysis. So let us see in short about each one. The glomerular function test. The most commonly performed glomerular function test is the clearance test. So clearance is what is clearance? You know, a particular substance which is cleared of the plasma in unit time is referred to as clearance, and this is calculated by the formula UV by P. U is the urinary concentration, V is the volume of urine, and P is the plasma concentration of that particular substance. And why do we calculate clearances? Calculation of clearance helps us to get an approximate estimate of the glomerular filtration rate. So, you know, the normal glomerular filtration rate will be roughly around 120 to 125 ml per minute. So, these clearance tests are an indirect indicator of glomerular filtration rate. From clearance, we use certain formulas which are like MDRD formulas and Cockcroft-Gault equations, which used to help us in calculating the approximate glomerular filtration rate. And there are various substances which are used to study the clearance. There are endogenous substances which are present within the body. So these are non-invasive. We also have exogenous substances which may be invasive. Now if we see the non-invasive endogenous substances, urea and creatinine are the most commonly used substances to study the clearance. So urea clearance and creatinine clearance, and among these, creatinine clearance is more specific than urea clearance because urea is going to be affected by a protein intake, so whereas creatinine does not have such factors which will affect the values. And in addition, you also have exogenous substances. You're going to give a substance from outside and check for its urinary concentration and the plasma concentration. Such a substance is inulin clearance, and inulin clearance test was once upon a time a gold standard for the estimation of GFR. Currently nowadays we do not perform such investigations such as inulin clearance test. So urea clearance and creatinine clearance are commonly performed. The various other blood investigations which help us in assessing the glomerular function tests are serum urea. Serum urea, the normal reference range is around 15 to 40 milligrams per deciliter. But increase in urea levels can also be affected by the protein intake of an individual and also the hydration status of an individual. Dehydration can lead to increased urea levels, and also high protein intake in the diet can also lead to increased urea levels. So we have the next more specific marker for kidney, which is the serum creatinine. Serum creatinine reference range differs among males and females very slightly because of the muscle mass. For males, it will be slightly higher, 0.7 to 1.4 milligrams per deciliter, and for females, slightly lower, 0.6 to 1.2 milligrams per deciliter. And creatinine levels are also elevated in case of muscular dystrophies. Then we have the next group, which is serum uric acid. Serum uric acid, you know, uric acid is the breakdown product of purine metabolism. The normal reference range varies from 2 to 6 milligrams per deciliter. So increase in uric acid levels are also seen as a part of gout, the hyperuricemia, the various causes of hyperuricemia which we have discussed under purine metabolism. So these three are the blood markers of glomerular functions. Then we have the tubular functions. So I told you the function of tubules is the concentrating ability of the kidneys. So we have two major tests. One is specific gravity, which is a measure of the amount of solutes present in the urine. And then you have osmolality. Osmolality and specific gravity vary with the intake of water by the particular individual. We also had water loading and deprivation test, which are completely or considered obsolete nowadays. Then coming to the urine analysis, we look for the physical properties such as volume of urine, which gives a very important clue. Then the color of urine, odor of urine, appearance of the urine, and specific gravity, pH. All these are the various physical properties which we test in the urine sample. And then you have the various chemical tests where you check for the presence of ketone bodies, presence of proteins, presence of bile salts, bile pigments, presence of urobilinogen, and also you can check for various reducing substances. All these comes under the chemical test. And finally you have the microscopic analysis where you can see the casts which can help or give a clue to the diagnosis. So the renal function tests include urine analysis, and then you have the glomerular function test, and then you have the tubular function tests.